This is Harry. Doesn't look very happy, does he? That's because Harry doesn't exercise, he smokes, and he eats too much unhealthy food. He doesn't know it yet, but Harry has developed type 2 diabetes. Let's go inside Harry and find out what's going on. Harry's poor diet has resulted in a buildup of fatty deposits. The insulin produced by his pancreas and the glucose in his blood cannot get inside the fat and muscle cells to produce energy, causing a high blood sugar level. Unless a cure can be found, Harry and millions like him worldwide could eventually face heart failure, kidney damage, nerve damage, and even blindness.
Diabetes is one of the few major diseases in the world that is on the rise. Today, the world is estimated to spend at least $232 billion annually to treat and prevent diabetes and its complications. There are currently 246 million people with diabetes. This will increase by a staggering 55% by the year 2025.
Obesity and type 2 diabetes give us the biggest epidemic that we've ever seen in human history.
Diabe is an Australian company listed on the Australian Stock Exchange and is supported by a team of world diabetes experts and research organisations. Diabe is well positioned to provide innovative diabetes treatments on the world stage. Our internationally recognised board of directors is led by Dr. Michael Wooldridge, former Australian Federal Health Minister. Professor Sir George Alberti, the UK's respected medical advisor to the Blair government. And Neil Hewitt, former senior partner with global giant KPMG. ISF 402 is Diabe's flagship project. It's an orally active peptide that assists in the action of insulin.
There are several advantages of ISF 402 in the therapy of type 2 diabetes. Firstly, it appears to be a natural product, and the studies so far suggest that it isn't toxic, so it's unlikely to have side effects. Another advantage is the fact that even though it's a very small protein, it can be taken orally. And the fact that it's a very small protein also means that it can be synthesized very easily and manufactured easily.
Insulin is stored as hexamers. When released into the blood, the insulin breaks free from the zinc ions holding them together. ISF 402 works in two exceptional ways to increase the insulin signal. Diabe tech scientists have found that ISF 402 can increase dispersal of insulin hexamers by binding to the zinc. Without the zinc ions to stabilise them, the hexamers break apart more rapidly, making single molecules of insulin immediately available for binding to receptors. In addition, ISF 402 amplifies the signal generated when insulin binds to its receptor, so that less insulin is needed to signal to the liver to take up and store glucose from the blood.
ISF 402 does appear to have a unique action and improves how insulin works in the body, but in a manner which is different to existing diabetes products. To our knowledge, this is the first drug for type 2 diabetes ever developed in Australia that has got to this stage of development. There's already great interest from global pharmaceutical companies in the ISF 402 project.
IMO14 is a natural product derived from a bark extract that will assist in long-term insulin therapy.
This project, in a very short space of time, has gone from what is basically an anecdotal idea to a potential drug in the space of something like 2 years or less. And to me, that's very exciting. What we're hoping to achieve with IMO14 is an adjunct to insulin therapy to give patients a better prospect of long-term management through drugs of their diabetes. Well, the raw material for the IMO14 project is something that we've been working very hard on over the last probably 3 or 4 years in particular. We now have very good chemistry and and good understanding of the composition of IMO14. We have identified one very active component.
The CDA1 project is targeting a newly discovered protein that causes scarring and complications within the kidney and vascular systems after the onset of diabetes.
In diabetes, in the kidney or in the heart, people develop too much scarring, and we're hoping that by blocking the action of this protein, CDA1, we can reduce or prevent kidney disease and heart disease and diabetes. So we're up to the stage in the project where we need to find a chemical that blocks the way CDA1 binds to this protein. And by doing this and identifying such a chemical, we potentially will have a new drug to prevent scarring. I've been in diabetes research for over 20 years, and over that time, the real problems for a clinician has been how to improve management of diabetes and to prevent the complications. So what really excites me about Diabe is how we have these 3 projects that are directly addressing these issues, and this has great potential for diabetic patients.